you can come out to that. It'll be hosted at the Bay Shore as well. So make sure you guys tune in for that. And we'll see you next season for another round of Attack Wrap and another season of Owen Sound Attack Hockey.
You're watching Rogers TV.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I'm absolutely delighted. I've got a room full of guests, a Zoom room full of guests. So I want to thank everyone for being here today, and I'll go through the list. But today we are talking about cultivating curiosity, implementing innovation, with the Office of Research and Innovation at Brightshores Health System. So thank you to everyone. In no particular order, just in the list that I have, Ann Ford, who is President and CEO of Brightshores Health System, Dr. Mike Williams, VP of Medical Affairs, so that's Vice President. I'm assuming that's what that means. I said I want to be careful not to use acronyms, and there I went and did it. So Vice President of Medical Affairs and Owen Sound Emergency Physician, Dr. Rebecca Brookham, Director of Research and Innovation, and Amber Herrington, Nurse Clinician. Welcome all. So you're here to tell us about an exciting new initiative that you're doing around research and innovation. And I'm wondering, Anne, did you want to begin, or who would like to begin telling us a little bit about what it is and what some of the benefits are?
Well, hi, Carol. Yes, I can start us off, and good afternoon, everyone. I'm Ann Ford, and thank you so much for having the team here online with you. And really, we want to talk to folks today about the benefits of having a research and innovation arm associated with Brightshores and our 6 hospitals across the Grey Bruce region. And we know that not unlike, I think, most of the world or Canada or even Ontario, certainly our communities have health issues and needs that we need to think about, not just in the today, but in the tomorrow. And knowing the demographic shifts that are coming our way. We know that the last bit of the baby boomers are coming along and will hit 60 in the next year or two. We also know that as we all age, some of our disease process gets worse, unfortunately. And so how do we, through research and innovation, think about how do we help people in the future who might have a lot of comorbidities, or even, I think more importantly, how do we help folks not come along and have those health issues as they get older? So I know today we're going to be talking about, wound care and those sorts of things. And diabetes will be one of the big health issues across our populations. It is now, as Amber will talk a little bit about, and it will be in the future. So some of the work we're doing right now is around how do we recognize diabetes faster? How do we treat it? How do we help folks stay healthier with a diabetes diagnosis? Maybe stay out of the hospital and help provide some services within their homes. So that's, a bit of how research and innovation is going to help us going forward. So I'll stop there and hand it over to somebody else.
Thank you for that. And I think it's really important to make that connection. And today we're going to talk about the combination of research, which is learning about things, but the practical application of what it means to the person who's coming to the hospital setting. And that's the part, the connected part that we all look for in healthcare. So I'm really interested in learning more about that. So the flow I was given, so you guys have to redirect me if I get the traffic wrong. But Dr. Mike Williams, I understand that you certainly have some information and some experience that you can share about how research and innovation will help you and certainly help the patients that come to the emergency room. So you'll have to unmute because I see a little red line through your mic.
Yeah, no, there it is. There it is. Certainly, Carol, one of the things that we look at is keeping up to date as far as providing care for patients in different circumstances. And one of the things that we look at here too is the differences and discrepancies in some of the information that we get from both urban and rural centers. So from the patient's point of view, obviously they want the most up-to-date, the most correct care that they can receive. Doesn't mean that what they've received historically is wrong, but as we get more information and research provides us with that, we can certainly provide better care for that. If you look at the information that we get, a lot of it's generated in the academic and tertiary care centers and really centers around an urban population. One of the huge advantages of what we're doing here is our database, our collection base is from a rural population. So it more directly applies to the patients that we're seeing and the circumstances that we're seeing with things. And in some cases, you'll find that there's a particular diagnosis, a particular concern that has some very time-sensitive implications with what is used for treatment and how the treatment is provided. In those cases, we now have some ammunition to lobby for. We need other equipment or we need other resources here for our patients. Or how can we access them? And even to take it a step further, if we can't do that, what are the best workarounds? So what can we provide here that's the most beneficial for the patients? Or is it in fact, how do we lobby for a more efficient transport system to get them to where they can? So it's very exciting in that it's going to provide some clarity to a lot of these questions. And looking forward to being involved with that. Enjoyed it so far and not surprised that it's going as well as it has with people's interest in it.
So I have a question for you. First of all, the fact that it's rural and has rural implications, I think, is special and very unique, and I think that's a plus for sure.
Absolutely.
And so that's great news. But also, can you fill me in a little bit about how this might impact physician retention, but also to attract physicians to come to our area, because that's such a critical issue of concern, certainly not just in Grey Bruce, but further afield. What do you think research and innovation does as far as physician recruitment and retention?
No, those are great thoughts, Carol. One of the things about retention is that we have physicians here who've been involved with research in the past. And you can appreciate in this environment, the clinical demands on them are extremely high. It takes a fair bit of time and really a team for people to be involved in proper research, whether they're part of a bigger research plan or whether they're looking at being primary investigator. By setting up the Research and Innovation Institute, they now have a team wrapped around them. So they have a lot more support, not just in the data collection and processing it, but even at preparing to present this to the ethics board that's associated with the research and innovation. There's a lot of things that will allow physicians who are here with significant track records in research to continue that. And I think that will mean a lot to physicians as far as creating a practice environment that allows them to practice and do the things that they want to do. With recruitment, it's a further step of the same scenario. I think what it's going to do is allow people who are looking at careers in an academic center to be able to function in a community center and continue with those goals, effectively creating a wider candidate pool for us. So I think we'll be able to carry out some fairly high-end research, being able to attract those people up to the area. And the fact that we can attract more people up to the area is great because we need them clinically as well as for the research.
Absolutely. So it sparks in so many different ways to be able to help our community. I'd like to go to Dr. Rebecca Brookham now. And I know that you will have some slides for us, but I'm really curious. I know you've been running for about a year, so we want to hear about what's been happening. But where does the money come from? And do you have some specific requests? This is your chance to make your ask if you have any.
Great. Well, thanks, Carol. It's been a fabulous year. We just celebrated our first birthday on May 1st, and it's been a really fun ride. We've been completely so impressed with the community support and the hospital support, and external to that too. People are excited about what we're doing. It's very unique. It's something that really special that has come to a community hospital in a rural region. And as Dr. Williams mentioned, it's unusual because a lot of the research is driven by those urban centers and is very applicable to urban populations that not always the most suitable for rural populations. So as we started out a year ago, our ambition was very clear, and that remains to be clear, that we intend to become recognized as the leader in rural health and wellness research and innovation. And the funding, we've been very generously supported with some seed funding from the hospital to get us up and started. And we've been working through a number of grant applications and have had good success on that, which I'll share with you in a few moments as well. But we're also reaching out to the kind and generous community as well and looking for them to help support us, especially as we're launching forward. We need dollars to start seed funding projects, and success breeds success. So that's a big part of it. So you'll see here in a couple of slides about what we've accomplished and some of the great generosity that we've already experienced here from the community. So I'll just share with you, sometimes it's easier to see and hear at the same time what our focus is. So we really have four main pillars of research that we're focusing on. The first is population health, and that is looking at the people within our community and what their healthcare needs are. We're very unique in our beautiful 8,600 square kilometers of geography. That comes with the challenges that are related to healthcare as well. So we want to address some of those and think about the needs of the people living within those communities as well. As was already alluded to, there's a great number of aging seniors, and actually across the province, we have more adults that are over 65 years of age than anywhere else. Those numbers are going to continue growing, and we want to ensure that we can provide to those folks a healthy aging experience. And for those frail seniors, be able to anticipate what some of those challenges are and be able to address them in early days. The second pillar is called chronic disease management. So certainly not an exhaustive list, but you can see there are lots of things that pop out: diabetes, mental health, addictions, cardiology, stroke, all of those things. Sometimes we see this is where some of our clinical trials come in. And so you can think of perhaps a pharmaceutical company that has a new medication that is ready to be trialed with some patients. And that presents to our patients a fabulous opportunity. Some that have, very difficult diseases that they're dealing with, they would have to travel hours to an urban center to be able to participate in some of these trials and have access to some of those experimental drugs. So we're really happy that we're going to be able to provide those experiences locally to our patients. The third pillar and focus is what we term technology and digital experience. And really, you can just think of technology. We know changes every day, and there's all sorts of medical technologies that are coming about that have really great value and potential to be implemented into the healthcare setting. And that's where we have this tagline of implementing innovation, because we have lots of problems that there may be new ways of solving them, new solutions, different ways of doing things. So we want to trial some of those medical technologies. We're going to speak with you, with Amber, about one of those that we're bringing to our community here in Grey Bruce. There's also a lot of opportunity to use some of these emerging technologies to explore the vast amount of data that we have now. We've got lots of numbers, but we don't always use it enough to be able to predict down the road what some of our problems are, or to understand how some of these solutions may come about. So we're looking forward to really digging into some of those areas. The fourth pillar is very near and dear to my heart, and it's healthcare worker stability and wellness. So we think about our working population of healthcare workers, those heroes that come in every day and do their job, that are not easy, and the demands are high and they're increasing. And we've heard across the nation and beyond that these staffing shortages are unprecedented. So we want to have a real dedicated focus on not just the physical and mental health promotion of our staff and our workforce, including our physicians, but also looking at, again, innovative solutions. Is there different ways that we can work together with interdisciplinary groups and so on? And the physician recruitment and retention that Dr. Williams spoke to, it fits in this model as well. The physicians are having the opportunity and the support to be involved in research. It attracts physicians to come and be here and allows them that satisfaction, not only to develop professionally, but to provide to their patients perhaps some other opportunities that they wouldn't have otherwise been able to do. So my next slide here just speaks a little bit about the success that we've had within the last year. So I'm going to focus in on this middle column and share with you some details about some of the projects that we've been doing. So we have 5 clinical trials underway right now and 4 academic studies. We have 5 innovation projects, and we'll give you a little bit more detail about one of those in particular. And we've had an enormous response from a lot of stakeholders who want to partner with us. They're excited about what we're doing. They know it's unique. They know it's different. It's rural, and we're attractive as a partner. So people are coming forward and saying, hey, I want to be a part of this. I want to partner with you, and let's see what we can do together. So at the bottom there, you see a lot of different logos of 14 partnerships that we've developed so far. Also, we're so thrilled to announce that within the last year, we have brought in a whopping $1.6 million of funding, which is a great start, but certainly needing to continue that. Very generous donations from our hospital foundations and community at $180,000 as well. So as I mentioned on the onset, these dollars are really important. A lot of studies and opportunities don't come with funding. And to be able to get up and started and prove value and worth, we really need to continue receiving that support. So thank you for that. One of the projects, sorry, Carol.
So people listening in or watching,
yes,
if they wanted to donate, how do they donate? How can they say, you know what, this is important? And I know Amber's going to give us a real example shortly about what difference it makes in care. How can they donate to you?
Yes, thank you. Really important. You can donate through any of the 6 hospital foundations. So you can go through the Brightshores Health System website or to the hospital foundations directly. And there's a very easy way and pathway to do that.
Yeah, thank you.
So we'll focus on one innovation project that's getting up and started, really excited. We received funding from the Digital Global Innovation Cluster for this, and we've developed with a consortium who's shown here on this slide at the bottom, what we call the Advanced Artificial Intelligence Wound Care Network. And what this means, we've got lots of wounds. You're going to hear from Amber as our wound clinician, as our nurse clinician and wound care specialist. You're going to hear from her about the challenges that we have with wounds and how many there are and how few of her there are. And some of the difficulties in assessing a wound. What this technology does is it's essentially a software application that can be downloaded onto, your simple iPhone device and can be put into the hands of our frontline staff. They're able to go and take a photo of a wound, whereas before they may be using a paper ruler to try to measure its width and its length, sometimes a Q-tip to get probe in and see how deep it is, which can be painful for the patients as well. This technology will allow us to take a photo of it, and using artificial intelligence, it gives a really accurate measurement of how big that wound is, can track it over time as we take, continuous pictures. Can measure the depth of the wound, and it also characterizes the tissue. So again, using artificial intelligence, it can look at the tissue and sort of characterize it as to different stages of healing or otherwise. All of that information together compiles this very beautiful standardized documentation of assessing a wound and allows it to track for a patient over time. So you can start to see, and you can show to the patient themselves, look how, it's getting smaller, it's getting better, and give them a projection of healing time and provide some clinical guidelines and tips for our clinicians as they're making decisions along the way as well. So really exciting project. And sorry, Carol, jump in.
Oh, no, I was just going to say, now you've really piqued my curiosity. I want to be sure Amber tells us. So would it work for the group if Amber spoke a little bit about wounds? Because, oh my goodness, you've got so much information to share. I know that so how
Yeah.
does that work for the group? Can Amber,
Sure, Amber. Yeah.
Amber, fill us in. We've got some time.
Yeah. So wounds are something that we spend a lot of healthcare dollars on. They can cause a lot of pain and suffering. They change people's quality of life. And so when we have um, something that becomes complex or chronic, or it's going on for a long time, how we manage that as healthcare providers, because we're split up, right? You might be receiving care from your family doctor, here in the hospital, from community services, that sort of thing. Um, we're looking for a way, and what the Swift technology is going to allow us to do is, at least within our boundaries in our Brightshores system, is to create a way to for myself to assess. We're going to have frontline staff that are able to take photos and that sort of thing. So that will make my job a lot easier. It's going to create a place, a centralized place for all wound assessments to be, so that all of our staff, nursing physicians at all of our sites, can get access to that. They'll be able to go into it. For example, if a patient comes into a merge and they've got a diabetic foot ulcer, they could be being seen by our diabetic foot clinic. The physician would be able to see the most recent assessment, what we saw, what our current treatment plan is. Did that wound look infected when we last saw it? So the physician now is in a position where they're looking at a wound. They can see that it has changed dramatically in, a couple of days or in a week. And then that's going to help them accurately guide treatment, because they're not left wondering, did it look like this 2 days ago, 3 days ago? Is this actually a change? Should we be concerned? Should we not be concerned? So when we're trying to heal wounds closed, there's a lot of factors that we look at. Having a proper assessment of those factors helps us to guide treatment, and then assessing wound progress. So what we do currently to, for example, measure a wound is we're using like Q-tips, paper rulers, that sort of thing. It's not the most accurate system, but it's the best that we've had available to us up until this point. Lots of people, it's not bothersome or overly invasive for them to have a wound measured, but some people's wounds are extremely painful, for example, and just touching the surface, that sort of thing, is a lot for them. So this technology will allow us to take photographs, and it will make a far more accurate picture of the wound and of the volume of a wound, because essentially what we're looking at is length times width times its depth. And how we track if a wound is healing is the amount of open space in a wound decreasing. So we're looking for that progress, and we track that. We ideally want to see on a hard to heal wound, if we've got all the right factors going, we want to see a 30% reduction in the volume of that wound within 4 weeks. That tells us our patient is on track to come very close to closure within, for example, 3 months. We have lots of patients that they don't quite fit those guidelines, and it can be very difficult for us to actually assess how much progress they're making. A picture is worth 1,000 words. Yeah. So when you have an accurate picture that we can now track, because we do assessments and we track things, but we don't have an easy way to put photos into the patient chart that all providers can see. So this technology allows, for example, me to take a picture and to do my assessment. And once I've done that once or twice, those are available. We can come back and look at the wound that's in front of us today. This will allow us to superimpose a picture from previous over top of the wound to get a really good visual of, it was this big, now it's this big. We can show our patients that. They'll have a far greater understanding of, is my wound actually healing? Because part of that with measurement and is it healing is one side of a wound might be 1 centimeter deep and the other side could be 5 centimeters deep. So it's hard to get a really accurate measurement. And so we're going back, and today, the greatest part of the wound is 4 centimeters deep, but that doesn't reflect the other side that actually filled in and has come to surface.
Yeah.
So it's not the easiest to track how much progress they have made, and are they actually making progress? Because that's the other part. When we trial a treatment and we get started, we want to see that it's progressing within a couple of weeks. If it's not, this will allow us to realize very quickly it's not progressing and get us to change the treatment sooner. We'll know that what we're doing is not working sooner. And it also makes it so that if people are moving through the Brightshores system that have SWIFT as part of their charting, anybody will be able to see whether they're progressing or that sort of thing. So it puts a far greater amount of information in the hands of our providers so that we can provide better care for them.
Now, from what you're describing, and I look to Dr. Williams and yourself, you're really describing optimizing patient outcomes.
Oh, yes, absolutely.
And I look to Anne, you're maximizing efficiencies and cost effectiveness through this. So connecting operationally a hospital, how a system works, and the clinical outcomes and patient satisfaction all along a spectrum. Do I understand correctly?
Yes, you're absolutely right, Carol.
Yeah.
And it's also, I would add a fourth to that, is it's actually providing care potentially in a patient's home so they don't have to travel for that healthcare.
So that's one additional benefit of a system approach using research and innovation and new technology. Sorry, Amber, I interrupted, but I got excited about what you were saying.
That's okay. And I would like to share a little bit about that. So I'm the wound care specialist for Brightshores, and so I do travel as needed to all of our sites. But as you can understand, with 6 sites and being one person, I can be very stretched pretty thin at times. This is going to allow us, once it goes into the hands of our frontline workers, it's going to allow them to take a photograph that can go along with the referral for me. It's going to allow me to triage patients faster. Some people don't actually need to be seen in person. Their wounds are fairly simple, what have you. So it's going to allow me to triage and to see in person the people that need to be seen, for example, urgently, the ones that could wait a day or two, the ones that we can just provide guidance and direction and they don't have to be seen specifically. It should create a situation where I can follow up easier and more frequently with patients as well, because their regular nurse will know that, like, we're going to take a picture once a week of this wound and the specialist, I'm going to review it, as opposed to trying to get in person and see each person. So from my perspective, I feel that we're going to have more access for patients to have their wound assessed by a specialist, even if that assessment is not actually in person all of the time. And it has the potential to reduce the number of times patients have to come to Owen Sound to see the specialist, that sort of thing. And it means I can show the physicians, the surgeon or what have you, what's actually going on with their patient today without having to take down that dressing and put the patient through all of that again. So just as examples.
You know, I cannot believe our time is up. Wow. I want to invite all of you back again to provide an update on how this is working. What a wonderful, wonderful initiative for all of our communities and the patients as well. Excellent. And certainly, please consider this an invitation. You have my email, so please come back. Thank you all very, very much. And I want to thank our viewing audience for joining us today to learn more about programs, resources, and services available to you and to your family. Take care and stay safe. Thank you for joining us. Double thumbs up.
Connect with us by visiting our website or email us at comments@rogerstv.com.
Oh, hey. Wait, what was the question?
Let me guess. One driving high combo, extra baked?
No. Could I get a burger with a side of fries?
Think you're a better driver when you're high? Think again. Smoking weed affects reaction time and concentration. A message from Mad Canada.
This is Rogers TV.